and welcome to another episode of Operator Relief Fund podcast series, Stories with an Impact, powered by Carasoft. Today, we have an amazing guest with us today, our first provider and practitioner of this Stella ganglion blocker, Neurosympathetic Reset. Honored to have you, Dr. Mike Lowers with Reset Medical and Wellness Center in Strongsville, Ohio. And before we dive into this, full disclaimer, because we're all about transparency, I grew up about 20 minutes away from the Reset Clinic in Northeast Ohio. So shout out to all my Ohio brothers and sisters. But Doc Lowers, Mike, pleasure to have you. Really appreciate you joining our
Thank
show
you
today.
so much, Matt. It's really an honor to be on here with you. And it's an honor to work with your organization. It's been such a remarkable achievement in my life to be able to treat special operators, to be able to give back to that community. It's just amazing. I'm not military. My dad and my brother are both Navy. And I don't know if I told you that before. It's really it's been just been an amazing career journey. Although I'm not from Ohio originally, from Michigan originally, love being in Ohio also.
Well,
I know.
we're
It
we're
Trust
we're
me,
gonna
it's
we're gonna
rough.
breeze over that. We're gonna breeze over that. But you found the true homeland. I don't want to
Yeah,
cause a riff in the
yeah.
Buckeye.
I'm really going to jab it to you when I say that I went to the University of Michigan, did most of my training there. So
I saw that.
it's tough.
We'll
Yeah.
cross out the I. No, we'll honestly, a great spot to start. If you don't mind, let's kind of dive a little bit into your background. A military family, you got Navy in there, obviously University of Michigan. I know you're double board certified. Take us through a little bit of your personal, medical professional journey.
Absolutely.
Where'd you start? And then how did you end up, partnering and being the chief medical officer at Reset?
Yeah. No, absolutely. My journey started back at the University of Michigan. I did my training in physical medicine and rehabilitation initially, um, delved into a lot of sports medicine and spine care. But I also did a fellowship in anesthesia and interventional pain management. And with those specialties, when I came down to Ohio, it was 2012, I think, and that was sort of, if you recall, that was about the peak of the opioid epidemic. And there was a big need for addiction treatment. So I started my career in Ohio doing just that. I did a lot of addiction treatment and transitioned to a lot of chronic pain management. But of course, along those lines was a frustration that I was often not really getting at the heart of those conditions, which, as I'm sure you know, is emotional, physical trauma. And we see it all the time that conditions are treated based on their symptoms, but not really on their root cause. And so I wanted to be able to start a career path that was really addressing those issues. I opened this center in 2024, as you mentioned, with a partner and colleague of mine, and it's really been an amazing journey being able to get to that root cause treatment and be able to to do more than just that volume based care, but really value based care.
Yeah. Talk a little bit about Reset specifically. So, um, you know, trauma informed, evidence based healing modalities. Talk a little bit about, what does Reset do now? And if you don't mind, like differentiate that to some of the experiences you had prior to Reset and what was kind of the driving force behind switching from
Yeah,
what I would kind of call maybe traditional Western medicine, pharmacology to some of the more trauma informed evidence based therapies that you see today.
absolutely. Yeah, I mean, we started Reset to focus on anxiety and trauma conditions, right? And we wanted a center that served a number of purposes. One, it was really getting at those actual injuries, the root cause of the problem, but also it was doing so in a fashion that was trauma informed. And we sometimes use that term loosely, but especially in medicine, it's really critical to be trauma informed, to understand what a person has been through, to recognize their trauma and help them along that journey. It's all too often the case, and I'm, equally to blame in past um, you know, work experiences also, that patients are treated as a number. Hey, come on in. I got 5 minutes to address your hypertension, another five to address, your exercise that you're getting, and then we got to wrap it up because I got to spend an hour on the phone with the insurance company trying to get this MRI approved. Right? How many times have you done that? Have I done that? Too many to count. And I was extraordinarily frustrated by that because I would spend an hour with this patient, but not in face to face time. So now the idea here is that it's a welcoming, trauma informed center. It's a wellness, mind and body, holistic approach. And it's doing so with the focus on really educating the patient. If you can understand trauma, then you're far more apt to be able to heal from it. If you know what's causing it and how to move forward, this isn't just getting in and doing a block and, hey, good luck to you. That would help. I'm sure there's a lot of folks that would do fine with. But my research, my interest lies in how do we really optimize this? And that's how it.
Talk to us a little bit more about, so we have, what I'll call like the symptomology, right? Like you have anxiety, you have stress, you have trauma, whether it be physical, mental or emotional. Walk us through some of the physiological effects within the body. Like, not necessarily like what is stress, but what if we're stressed, if we have anxiety, post-traumatic stress, what physiologically is happening in the body?
Yeah, it's really simple, Matt. It breaks down to this: humans are really good at adapting to their environment, right? And as a former special forces, you probably know that more than most, right? You go to a hot climate, you get used to that. You're at high altitude, you get used to that. You're putting your body through intense situations, you get used to that. And that nature that we have can be helpful, but it can be damaging also. Because if your environment is stress and chaos and intensity and trauma, and it's there enough, our body remembers that. It holds on to that. And essentially, the only way it can, which is escalating our threat response meter, right? Our ability to sense threat. And sometimes we take advantage of it, right? Sometimes we use that to be on all the time. But the result of that is that eventually, when we remove ourselves from those stressful situations, we recognize that, well, guess what? We're still on all the time and we can't shut it off. And that's a serious problem because then it leads to your threat meter triggering in to benign things in your environment. A conversation with your wife, the kids acting up and you getting irritable, not being able to rest your mind and fall asleep. And so you start to have all these symptoms, even though you're in a safe, supportive environment. It doesn't matter because your physiology has recognized a history, a pattern of threat and response, and it's just continuing that. And even though there's no threat, it doesn't matter. Your brain perceives threat. And it's a very difficult pattern to reverse. And most traditional treatments focus on simply addressing the symptoms, right? And, hey, I get worked up. I can't calm my mind at night. So you take some deep breaths. You try to meditate and you do therapy. And I'm a huge advocate of those things, of mindfulness practices and trauma therapy. But the problem is that for many, it's an exhaustive repetition,
Sure,
right? Where they're
sure.
they're they're activated, they can't stop their mind. They slow it down a little bit for an hour, a few hours, and then boom, they're right back up there. And that repetitive roller coaster of activation and calming, a lot of folks just, they give up on that and they say, hey, it doesn't work for me. And that's where we come in.
Well, one of the things I want to expand on, you talked about like the home life, blowing up at your spouse, blowing up with your kids, you know, prior to becoming world famous on a podcast, I did a lot of onboarding with the participants that we do at Operator Relief Fund.
Yeah.
That's almost the number one concern people have,
Yeah.
myself included. And I've been very open and honest with my story. And it's it's terrifying to feel not,
Not in
to
control.
feel not, yeah, I would say uncontrolled, to be
Yeah.
not in control of that. It's terrifying.
And that's what happens because this nervous system response, you have to know a couple things. Not only is it exceedingly common, but it is completely out of your control, right? Getting
Yeah.
back to the physiology, it's
Yeah.
no
Yeah.
different than if you move to Denver and you get used to high altitude, right? It's not something you're
Yeah.
trying to do or not
Yeah.
do. It's just how your physiology adapts to that
Yeah.
environment. And now
Yeah.
it's adapted to a situation where it's responding to everything as a threat. And when you're sitting like that, it's only natural that you're going to have this quick temper, this irritability, this restlessness. And the difficulty, of course, in that environment, like you're alluding to, is then it just doubles the frustration and anxiety
Yeah.
because you
Yeah.
act out, you yell at your spouse, you yell at your kids, and then 5 minutes later, you're in this horrible episode of grief and shame
Guilt.
and
Yeah.
guilt,
Yeah.
and that's rough.
Yeah, it's a vicious spiral. Nowadays, people always talk about moral injury, things like that, like the shame, the guilt. Um, it's real. Another thing I want to highlight, I think a lot of the burdens people have of seeking treatment are, let's just call it what they are, stigmas and things like that. But you're talking in the way you speak of just mental health in general. It's almost like a casual conversation that you're able to normalize. Hey, yes, something happened in your life, physical, mental, or emotional. There is a physiological response. How do we continue to normalize that conversation? How do we help break down some of those
Yeah, I
barriers
mean,
that you
it's a
think?
challenge. I mean, I can talk about it a lot, and that does help to some degree. It really helps when folks within the community, like yourself, speak to other military, to other first responders. I think that helps to break that stigma. I think just in general, for me, the simplest way is looking at it as an injury, right? I mean, if you broke your ankle and you toughed it out, 'cause you're a tough guy, right? And you walked on it and you got through it and maybe it healed in some way, but you're still limping, right? I mean, you wouldn't be not recognizing that there was an injury there. And more likely than not, what you'd be saying is, hey, let's get this thing fixed so I can start walking normally again. And that's if we look at it that way, like, hey, you've been through this situation, you have this injury, let's fix that injury, and then you can get through it and you can start walking normally and stop limping. And I think people recognize that and respond to that a little bit better than I have this, disorder and I don't know how to frame it and I can't see it on an x-ray. So we're trying to reframe it. And I think that can really help a lot too.
It's remarkable just having the conversations with people, and I love how you articulate as an injury, especially with post-traumatic stress, and that was deliberate. I didn't say post-traumatic stress disorder, right? The more that we can approach it as a injury as it is and recognize that there's treatment options available out there, it's a healing journey that we could go on, no different than a broken bone. Let's kind of move on a little bit to some of those treatment options.
Yeah.
Operator Relief Fund, we champion the neurosympathetic reset, the Stella ganglia block. Let's talk about that in your practice. Simple. What is a Stella ganglia block? Because honestly, I've never had a doctor on to actually describe it.
Yeah, oh, absolutely. So when we talk about that cycle of repetitive trigger and activation, right? These responses that are reflexic, that are out of your control. Well, they're mediated by a group of nerves, a cluster of nerves in our neck. And you can call it you can call it the gas pedal, you can call it the on off switch, but it's constantly stuck on in this repetitive feedback loop of response and activation. And what a sympathetic block does, and it does go by number names, and that's confusing too. I apologize for that in advance. But stellate ganglion is sort of one of the clusters of nerves along this group of nerves in our neck along that sympathetic chain. So a sympathetic nerve block, a stellate ganglion block, neurosympathetic reset, that's our term. These are all essentially synonymous terms with some subtle variances in how the approach of the block is done. But the idea is the same, that if we can simply pause this constant feedback loop temporarily, it allows that system to start to self regulate, right? So
Sure.
we're not living up here anymore at
Sure.
this constant hyperactivated threat response level, but we have more dynamic range, we call it,
Sure.
right?
Okay.
So if that's not green lit gas pedal all the time, if you can pause it, if you can hit the brakes, if you can control that, right? If you can self regulate, then you can get out of this fight or flight response and get yourself into a rest and recovery response. And that's the idea. And even a temporary pause in this constant feedback loop system allows that to happen. Not only does it allow it to happen almost instantaneously within hours to days, sometimes even quicker, you can maintain that benefit. And we can talk about this later, but that's where my research comes in. That's what I'm looking at. A lot of my predecessors in the field have looked at the basic science behind this, how to optimize that approach for the
Sure.
block. And that's
Sure.
excellent. That is very much needed science. What we need to look at now is how are we integrating this into the bigger picture of trauma treatment, right? How are we timing this right? How are we selecting the patient? And how is that patient then integrating, mindfulness practices and psychotherapy into their routine so as to get the most out of this?
Before we touch on all of that, if you would, walk us through somebody walks in, a new patient, and they're interested in a neurosympathetic reset. What is the physical procedure for our viewers who are completely unfamiliar with it?
Absolutely. So it is a injection. It's a nerve block. To give you a little background, again, because I warned you, I like to talk. So it was kind of discovered based on a old technique that's been around for a long time, a type of nerve block that is done for pain. And there was a lot in the 90s, a lot of folks that had, after Desert Storm, had upper extremity amputees. They were getting this block to help what's called phantom limb pain, which is, when you have pain in extremity that's not there. And they were also coincidentally finding that this was helping their post-traumatic stress symptoms. And then again, a couple folks in the field started to research that. So the block itself has been done for a long time. What it involves is using ultrasound to guide a needle down to this cluster of nerves, put some medication around that cluster of nerves to numb it, to
Sure.
turn it off.
Sure.
If anyone has ever had a regional nerve block before a surgical procedure, it would have looked very similar, the approach and the medicine that's used. The medicine is ropivacaine. It's FDA approved for nerve blocks, very commonly used for this type of block. So it's a very safe injection. And done with ultrasound, we can guide it very accurately. So the block itself is done on the right side on one day, and then we typically recommend that the left side is done on a subsequent day. So both sides are treated. They're treated on, opposite days because it's just a lot of anesthetic to have at any one time on one
Sure.
side.
Sure.
And then the actual block takes about 10 minutes. I mean, it's a very quick, very simple block to do, again, based on a well established technique. Afterwards, there's some temporary effects because of the numbing. So you'll have some heaviness in your face, some droopiness in the eye, some congestion, some superficial numbness, but very mild and manageable that lasts for a few hours. And again, the nice thing is that folks start to notice some of those benefits, some more profound than others, but almost immediately.
Sure. Sure. Are there any absolute contraindications to a neurosympathetic reset?
So there's a couple, but they're very rare. So pregnant women, we just generally elective procedures aren't studied during pregnancy, so that's a contraindication. Folks that can't hold blood thinners that are on a medication like Coumadin, Plavix,
Okay.
warfarin, those types of medicines,
Okay.
those need to be held up to the procedure for a certain amount of time. And occasionally patients won't get the clearance to hold those. But those are a couple, very unique circumstances. Beyond that, I mentioned, it's a very commonly done approach with a commonly used medication and very few contraindications and frankly very few risks. Yes, we're putting a needle in that area, but um, but again, it's a very small needle. It's a small amount of medication and a commonly used medication, so it really has very few risks involved with it.
Random tangent question on that, because I talked to a lot of folks who have like cervical trauma and they may have various cervical fusions at different levels. And whenever they ask me like, hey, can I still get it? My answer is always go talk to the doctor. What
Yeah, it's
what
almost always
what is the
yes.
doctor's response to that
Yeah.
question?
The response is there's almost no cervical surgery, and I've seen them all, that
Yeah.
would prevent me from doing this treatment on you.
Okay. Got it.
The exceptions would not be spine surgeries, which again, you're referring to, folks that have
Yeah.
injured their neck and had a disc
Yeah.
herniation, had a anterior, posterior fusion, those types of things. Those are all fine. Once in a great while, we'll get someone who had a neck cancer, neck or throat cancer. That would be a rare, very rare exception. Those folks sometimes have these kind of mass dissections done to
Got it.
remove the tumor, and their
Sure.
anatomy is very different. But any spine surgery is 100% okay to have this. I have yet in my career of 16, 17 years to see an exception to that.
Okay. Let's dive into the research behind it, right? And, full disclosure, Reset Medical and Wellness Center is partnering with Operator Relief Fund to launch a case study series, and we'll talk a little bit about that. But walk us through some of the research that you've personally done. What current research is out there, and where do you see the need for further research? Specifically with neurosympathetic resets moving
Absolutely.
forward.
Great question. I'm a huge advocate of research in the medical field. And so what has been done, there's been a few folks that have been doing this research, and I'm going to, name their names because I think that it's well earned in the field. But Dr. Sean Mulvaney, James Lynch, Sean Olmsted, Eugene Liphoff. So these folks have done some amazing work to get to where we are now. Again, a lot of that research focused around a couple things. The basic science. Why is this working? How is this
Sure.
working?
Sure.
And optimizing the approach. How can we best block this
Sure.
cluster of nerves?
Sure.
And it's been pretty well established that the optimal approach to this is A, to use ultrasound, and B, to do what we call a dual level block, which is essentially blocking two spots along that chain. Different thoughts as to why that might be beneficial. One is it might just be a more effective if you completely block this system, really shut it down completely to allow that system to reset fully. Another thought is that by blocking up at C4, you're targeting this cluster of nerves that's higher up that has more input into our emotional and fear processing center, like our amygdala. And so, regardless, there have been a number of studies by those colleagues I mentioned that have shown optimal outcome with this dual level approach. They've also looked a little bit into the duration of how long that can help and what specific conditions it can help. And to date, we've seen a post-traumatic stress, of course, and anxiety disorders seem to be the ideal patient, essentially the patient that we described earlier with the
Sure.
irritability and restlessness and
Sure.
insomnia, hypervigilance. But one of my specific interests is looking at other conditions that it can help. One of those conditions is traumatic brain injury. So again, with my background in rehabilitation, I have a strong interest in TBI treatment. So I published a paper not too long ago looking at how this can, in fact, benefit patients that are having these sort of recurrent but mild symptoms that there's really not a lot of good treatment for. I mean, they
Sure.
do some medications to
Yeah.
symptomatically help and maybe send them to speech therapy, but beyond
Yeah.
that, not too much to do for mild TBIs. And of course, that's not just military. We see a lot of athletes, right? We talk about chronic traumatic encephalopathy in
Yeah.
football players.
Yep.
And we see it in a lot of times where these post concussive symptoms are left unmanaged or untreated. And so this is a opportunity. And Dr. Mulvaney has looked at that a little bit too. And then my other interest and what we're partnering on is really looking at how this treatment fits into that, like we talked about, that broader treatment plan or scope of trauma treatment. We know how to approach this block, but now how do we get the most out of that? Where does the
Sure.
patient go from here?
Sure.
Because I would like to see it that patients are just getting this treatment once. Is that always possible? No, but ideally, that's what I would like to see. That they are really optimizing that post block care, and that's what this research is looking at. It's looking at a couple things. One, how are patients integrating this into their mind and body health? And two, how long can that benefit last as it relates to both post traumatic stress and moral injury, which you brought up earlier,
Sure.
which has not
Yeah.
really been looked at. And I think if we can document, if we can show, my hypothesis is that in an ideal situation where folks are integrating healthy trauma based, evidence based psychotherapy and mindfulness
Sure.
practice after this, they're
Sure.
able to maintain that benefit. And we're looking all the way out to 9 months because to date, a lot of the research is looking at like 6 weeks, three
Okay.
months. That's great, even
Sure.
6 months. But we want to push this further. We want to say, hey, this block is able to maintain benefit, essentially almost out to a year or
Yeah.
longer, particularly in those that can really do the work, so to speak.
Sure. And I love how you mentioned that. So the way I approach it, right, and the way Operate Relief Fund kind of approaches neurosympathetic reset, right? It's a tool that gives us time. And I always tell people it's the work we put in immediately after the procedure that pays the biggest dividends. Um, Talked a little bit about the research. What specifically is the research case study series going to be looking at? I believe there's multiple assessments, things like that. What 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 are you
Yeah.
what
So
data are you collecting that, you hope to use to
yeah,
push
again,
the discussion forward?
the main factors are objective measures of moral injury, objective measures of post-traumatic stress, like the
Yeah.
PCL5, objective
Yep.
measures of anxiety. And
Yeah.
then we're measuring those more or less monthly for 9 months, at various cadences. But we expect to see that there is a minimum of a clinically meaningful drop in these scores
Yeah.
that's measured almost immediately, and then again that's maintained throughout that entire follow-up course. That's ideal. I think we will see that to a percentage. Historically, what we've seen in the literature is about 70 to 80%, depending on what literature you're reading, of folks are responding to this, meaning they're having a clinically meaningful response. They're having significant response to this that's measurable on these objective measures. And I think we'll see that. That's not really the question. I mean, I always like to document that. The more we
Sure.
document that, the better.
Yeah.
But the real question I want to follow through with is how is that measured in other objective measures, like with moral injury? And again, how long is that maintaining? Even if it doesn't maintain fully, is that still clinically meaningful in 6 months, 9 months, et cetera? So uh,
I hate asking hypothetical questions and hypothetical discussions, but what do you hope to accomplish? Not just with helping the individuals with the treatment.
yeah, bigger picture.
15 months and 2 years from now, let's say, the study is complete, you're able to demonstrate clinical significance. What what's the next step? Operator Relief Fund, we kind of have our I don't want to say our own agenda by any means, but the VA, this is not widely accepted in the VA. This is not widely accepted in DoD currently. Insurance doesn't cover any of these treatment costs. What do you hope, in what way do you hope to kind of change the landscape or help move that discussion forward with this? Or is that a priority?
I mean, that is what the priority is, right? It is just recognition, and not recognition for
Yeah.
me. I mean, recognition for
No.
this
Yeah.
treatment.
Yeah.
because I mean, when we talk about research in medicine, I mean, I mentioned a handful of names there. If you looked up, hypertension management with some statin, I guarantee you there is hundreds and hundreds of physicians across, the entire world that have studied this in every possible way, right? I mean, I mentioned 5 or 6 names, and realistically, there's a handful of other ones, but that's about it. And that's really unfortunate because this is really an innovative and groundbreaking treatment, and it really is unfortunate that the VA is slow to recognize that. I'm not gonna say they
Sure.
haven't recognized it
Yeah.
because they are
Fair.
doing some of the
Very
research,
fair.
and
Absolutely.
and there's some good
Absolutely.
upcoming clinical research that's going through the VA that's looking at this. But, um, but it's slow, and like anything in medicine, it takes time, and the more literature that we have to back that approach, the more likely it is to be widely accepted, to be looked at as a gold standard of treatment, to be identified as something that should be covered through the VA, through insurances. So if we can get that, that's my 5-year plan. I'm not going to accomplish that with 1 or 2 or 3 studies, right? Again, that's going to take uh, dozens, if not hundreds of studies, but everyone matters. Every single patient that we treat, every single response that we get, every single
Yeah.
publication that we put out there is just more fuel for this fire that hopefully is going to light under someone's butt to get moving on recognizing this,
Yeah.
right? and
Yeah.
and of course for the patients, because like I said early on, and this is some of the most rewarding stuff I've done in my entire career. It's just, I mean, it's amazing to be able to make such a transformative change in people's lives. And as a father of 4, I mean, I get that whole dynamic of just wanting to be a better person, wanting to be a better
Yeah.
father, a better
Yeah.
family figure, just to be able to connect with, your spouse or your friends on a better level. I mean, if I can help, even one patient do that, that's well worth it.
I you know, you're being quite humble. I've been to your office and I know you guys have a board in the hallway there of the number of neurosympathetic resets. What I'm going to put you on the spot. What number are you guys at today?
Well, we're just under 700. I want to say it's about like 680, somewhere in that range. Yeah, we're very proud of that. We have a ongoing social media mission, fill the board, hashtag fill the board. Yeah, our goal is to treat 1,000 patients by the end of this year. And I know we're going to reach that goal, which is amazing. Right now, and you're going to know these numbers better than I do. I think there are 77,000 special operators, retired or active, somewhere around that number. Of course, millions of veterans and active military. And that 1,000 is amazing, but, that leaves a lot. And so is those little steps and those small accomplishments. But yeah, we really want to make this impactful for as many people as we can.
That no, it's remarkable the success, not only you as an individual and a provider, but Reset as a whole has been able to achieve since 2024. And
Yeah.
on
Thank
behalf of all of Operator Relief Fund, it's obviously a pleasure to partner with you and the entire team. We have a little thing on our podcast where I ask the same 3 questions to kind of wind down
Okay.
each episode. So, first one, what does healing mean to you as a physician? So, what does healing mean to you?
Yeah. Yeah. I mean, obviously, we talked about root cause healing, not symptomatic healing, because
Yeah,
symptomatic is temporary, short term
yeah,
gain, long term loss, right?
yeah, yep,
Healing means really getting in connection with the whole person. That's where it has to start from. And that's what we're
yeah,
missing
yeah,
in healthcare right now.
yeah,
Everyone has this tunnel vision. Everyone, the cardiologist sees the heart, and, if nothing's wrong with the heart, great. And then they're like, they throw up their hands. I don't know. Maybe
yeah,
it's stress. Who knows? Right. And you hear this from physician after physician after physician. And with the way that the healthcare industry is run right now, it's just very frustrating because no one's looking at that bigger picture. And that's what real healing is looking at the bigger picture, connecting with someone, listening to them, and understanding what's really contributing to those symptoms that they're describing. That's what real healing is to me.
I love that answer. The second question, this one kind of you were touching on it a little bit, but what do you wish more patients understood about their bodies?
Yeah, it really just breaks down to that. It's sometimes it's out of their control, right? And we try our best to eat healthy, we try our best to do the right thing, you know, but sometimes it's just you're just not in the driver's seat, and not to feel bad about that. You can be in a good setting, you can have the right intentions and be trying to do all the right things, and it still doesn't work out. And so I think if more people recognize that, there'd be less of that guilt and shame. There'd be a lot more advocacy and a lot less stigma for treating, especially mental health, but even other conditions.
Yeah. Last question, and you already just kind of brought it up, mental health. What gives you hope about the future of mental health care and, the expansion of healing modalities that like you're so involved with the research, but what gives you hope about the mental health care?
Yeah, what gave me hope started about 5 years ago, and it was actually with COVID. As awful as that epidemic was, it brought into the light people's mental health,
Yeah.
right?
Yeah.
I'm hopeful, people are recognizing that, not stigmatizing it as much, and understanding that if they really want to get better with any condition, any chronic illness, right? It's about having the right mindset, the right intention. And if you don't have that, you are hopeless, right?
Sure.
So
Sure.
having that reassurance that people are recognizing that gives me hope. It really does.
I love that. The best way to end our episode. Dr. Mike Lowers, I really appreciate you coming
Yeah,
on.
this
It
has been
was
fun.
nice to have a doctor to actually speak intelligently about it, and it's not just me rambling.
I try. I don't know. I ramble
No,
sometimes, but no, it's really been nice. I sincerely appreciate it.
fantastic. This has been another episode of Operator Relief Fund podcast series, Stories with an Impact, powered by Carisoft. If you are interested in learning more about the case study series sponsored by Reset in partnership with Operator Relief Fund, check out our website at operatorrelieffund.org. I'll also have the Reset information in the description below. Thank you, and we'll see you guys next time.